Hi, I'm Dr. Weibo. Welcome to the Innovation in Medicine podcast. As an engineer and physician, I've always been interested in innovation in medical technology. In this podcast, I'll talk to doctors, engineers, scientists, and other leaders in medicine to gain their perspectives on the past, present, and future of innovation in medicine. In this week's episode, I speak to Dr. Shaneeta Johnson. She's an associate professor of surgery, director of minimally invasive and bariatric surgery program, as well as Residency Associate Program Director at Morehouse School of Medicine in Atlanta, Georgia. As an expert in the fast-growing field of robotic minimally invasive surgery, Dr. Johnson has worked to institute and spearhead knowledge-based learning in this innovative technology at Morehouse School of Medicine. This state-of-the-art technology allows for improved patient outcomes, decreased pain, and decreased hospital stay by performing complex surgeries through minute incisions. So here is my conversation with Dr. Johnson. Hi, Dr. Johnson. Thank you so much for taking the time to speaking with me today. I know you have a very, very busy schedule, but I'm glad you took this 30 minutes of your day and to just speaking with me about innovation in medicine. So just to get started, Dr. Johnson has been my mentor throughout medical school, and she has just been one of those people who truly believe in her students, and I can attest to that. She was one of those people who truly believed in me and my dream of actually becoming an ENT physician and surgeon. And so she really pushed me to follow my dreams and to follow what I believed in. And, I would really say she's one of those people who are responsible for me actually getting into residency and becoming an ENT resident that I'll be starting. So Dr. Johnson, thank you so much again. And, I can't thank you enough. And I hope I would take the lessons that you have taught me, and I would pass them along for, the future physicians.
My pleasure, Dr. Weebenel. You're truly excellent.
I appreciate it. So just to get started, I usually have my guests introduce themselves about who they are and their credentials. So could you tell us a little bit more about you and maybe a little bit about your journey?
So I'm Dr. Shaneeta Johnson. I'm a minimally invasive and bariatric surgeon, and I'm at Morehouse School of Medicine. And my journey starts in the Bahamas, where I pursued a dream of practicing medicine that brought me here to the United States. I'm currently the director of our minimally invasive program here at Morehouse School of Medicine and have spearheaded the robotic surgery program at Morehouse and Grady Hospital as well. That has allowed us to bring in new technology and expose our patients to this advanced level of care, but also train our residents and students in this advanced surgical technology.
Mm-hmm. So I remember actually working with you, in clinic and in the OR. And I can just see of how much technology, as you talked about, that we use, right? And I just wanted to get your perspective on what you think innovation in medicine is.
I think medicine has seen a lot of innovation and continues to see innovation. Actually, innovation is really critical to medicine. We have to stay abreast of new technologies, new processes, so that we're able to provide the best level of care. Even in the COVID-19 pandemic that we are currently in, we have gone through many different changes of innovation, from the types of testing that's available, from being able to test for the virus itself to now being able to test serology to see if someone is immune or possibly immune to the virus. That's very important, so we have to be able to innovate and innovate quickly. And so when I think of innovation in medicine, I think about technology and I think about also processes. So being able to improve those real time, very quickly, to provide that highest level of care possible to the patient.
Nice. I like that. And so when it comes to your field of bariatric surgery, can you tell us a little bit more about maybe the history of the field? How did this field actually come about, and how did the improvement in technology kind of impact your field?
Right. So bariatric surgery has been around for a while. We've been doing bariatric surgery for more than 50 years. It is essentially weight loss surgery, but we no longer call it weight loss surgery. We also call it metabolic surgery because this surgery has been shown to have very positive, strong impacts on diseases. And so this is one of the only surgeries that can be used to treat a medical disease. And so
Hmm.
with this surgery, we're able to resolve or cure diabetes. Same thing with hypertension or high blood pressure, sleep apnea, asthma. More than 40 diseases are impacted by weight loss surgery. This surgery is almost 100% done in a minimally invasive fashion. So this is using technology now to our benefit and for the benefit of the patients. This means that the surgery is done with very small incisions. And through those small incisions, complex operations are performed. And the end result are tiny incisions on the outside of the skin, and a patient with very little pain was able to go home the next day and start a new life. I use robotic surgery 100% with my bariatric surgery. So I have taken that to the next level, and I now use an advanced surgical technology to perform these procedures that gives me 10 times magnification and gives me 3D visualization. And the benefit for the patient is no pain at all.
Mm, that's amazing. And so I know one of the technology you use is the Da Vinci robotic, right? And so I wanted to kind of know a little bit more about that. As maybe what series do you use right now, and then maybe the first one versus what we have now, and where do you see this robotic technology going in the next few years?
So the Da Vinci robot was first introduced and approved by the FDA in 2000. So this is now the 20th anniversary,
Hmm.
20 years, and we are now on the fourth generation. And so we have gone through several iterations, and I'm sure there are more to come, as they become more advanced and integrate more clinical knowledge, maybe vital signs and imaging within the robotic platform. But what we have right now is a platform that is operated from a surgeon console that is not attached to the patient's body, but it is real time translating the movements of the surgeon's hands to the movements of the robotic hands within the patient's body.
Hmm.
This allows us to do very complex procedures without having to make an incision. One of my partners says it's like crawling into the patient's body and operating from inside. That's the feel that you have.
I like that.
Yes, you can operate on the ceiling or the floor. You're inside the patient's body at that time. And
Nice.
so I'm sure that there will be more, robotic systems that come onto the market. There is another system on the market currently, and several more that are in development at this time. And that's going to just improve what we offer to the patients.
Nice. And so when you talk about the system, is that more of like still Da Vinci, or is there a competition when it comes to like, other technologies, other robotic systems pretty much?
That's competition. So Da Vinci
Mm.
has ruled the market for some time.
Hmm.
But last year was the first year that there was a new robotic system that was entered into the market, and there are several more to follow. So competition
Nice.
is coming, yes.
Nice. I guess to follow up on that question also, so are these systems as they're being created, are they following certain standards in terms of like, now you're already used to maybe to using the Da Vinci system, right? And you know exactly how you're operating. How does that translate to different systems or competition wise? And maybe how will that affect training if there is any differences?
Training is pretty complex for the
Mm,
robotic system. It requires a lot of time, a lot of energy.
mm,
There's a lot of different modules that are involved in the training, case observations, proctoring. It is quite intensive.
mm,
I suspect that with the addition of the new robotic platforms, that will only continue and not lessen. And the reason is you have to become very adept at this technology. We're
Mm,
dealing with patient lives, and we're dealing with patient lives in a surgical manner. So we need to be very, very careful the way we introduce technology into the operating room.
mm,
And so there will be the same training sessions involved. I expect that it will be the same time investment as
yeah.
well to introduce these. And then, one other thing we didn't talk about was when you're introducing a new technology like robotic surgery, it really requires a very, very comprehensive stepwise implementation into the hospital. So the
Mm-hmm.
hospital staff has to be trained how to take care of the machines, how to clean the instruments, how to troubleshoot. The residents, the faculty all have to be trained. You have to involve the electronic medical record, or IT has to be involved. The elect- electricians need to be involved. It's very, very involved to bring a system like that into any hospital.
Mm-hmm.
Not an easy undertaking. It's very thoughtful.
Yeah, yeah, definitely. And so when it comes to your day-to-day practice, how does this, I guess, innovation and technology overall impact your work? And maybe can you tell us about some pros and maybe some of the cons that you are experiencing as you're seeing different, even innovative technologies in your practice?
Mhm. It's a joy to use the technologies, right? I enjoy operating,
Mm-hmm.
and I also enjoy operating at a high standard, and this
Mm,
allows you to do that. It also allows you to do more complex procedures um, more efficiently, and I feel get a better result. The robot allows you to sit and operate, which is a lot more comfortable for a
yeah.
surgeon. There are
Mm-hmm.
studies that have shown that there's a longer length of life for the surgeon, a longer surgical life. We're able to be in the operating room for a longer time, and it's
Mm,
not as taxing on the body because
mm,
the ergonomics are much better. And so that's a win. That's a win for everybody. If your surgeon is more comfortable, that's a win for the patient too. That's a win for the staff.
yeah, yeah,
So those are definitely some of the pros. Some of the cons, this is not a cheap investment at all, right?
yeah.
So there is some cost that's um, that's going to be faced right up front, investment into the technology. On the backside, our patients leave several days sooner. And so the hospital can recoup savings from length of stay. This opens up hospital beds. Patients get back to their families sooner, back to work sooner.
Mm,
So there's tons of benefits from this. And one that we didn't touch on is the effect on opioid use, right? So if you
mm.
have less, there's less need for opioids, and so we avoid that whole conversation and dealing with increased opioid use after surgery by dealing with this technology.
Wow, wow. So that we can kind of see how the impact can just kind of, what do you call it, like a domino effect, right? Not only, you might have that initial cost of investing and actually putting this in the hospital and training people, but I can see how this can becoming way more efficient.
Yep.
And as we talked about with competition, right, with new technology, who knows, maybe this is going to be so cheap in the future that we'll be talking about this and be like, oh yeah, of course, like who's not operating in a robot anymore. So
Yeah, I
the
hope
future, all right, the future is definitely exciting. And so, just to touch on to that, what do you think is the future of tech and innovation when it comes to your field of bariatric surgery?
I actually do not know
Mm,
because this field is exploding so quickly. Last year, I presented in Japan at the World Conference of Robotics and Artificial Intelligence, and I was blown away at the projects that are being done worldwide in
mm,
robotic surgery. There are autonomous neurosurgical robots that are in development. There's so many other things that are coming down the pike. I really don't know where we're going to end up. I know robotics is here to stay. That I
mm-hmm,
know, but
mm,
I don't know where we are going. And honestly, this was started for the military.
Mm.
because you can imagine the benefit of this in a military field where you can have someone operating on someone that needs an operation right now, but may not be able to get to a hospital. But if you have this technology, you would have been able to maybe save a life, right? So that's why it was first thought up. And maybe that's where it will end. You know,
Mm.
maybe at some point we will get back to that and we will be able to use it in a military setting. There have been surgeries that have been done transcontinental
Wow.
with the robot.
Yeah.
Um, you know, so there, the future is very wide, very wide.
Yeah. Wow. That's exciting. And hopefully it will be in our lifetime to see some those of the cool things that, we think, it sounds like sci-fi or not sometimes,
Eh,
but but I feel like that's kind of where it starts, right? And in the past we would look at cell phones, or people would write these sci-fi books about these, I don't know, gadgets that you would have on your hand, right? And now we actually have these watches that are in our hands. So I
That's
think it
right.
I think that's the beauty of innovation. It's something that you can dream about, and then maybe you can actually go out there and then make it happen. So
Mm-hmm.
um and so the next thing I wanted to ask you was that what do you think is the role of a physician when it comes to innovation, and how open do you think physicians are with technology?
I think physicians are very open to innovation. I think it's
Mm.
part of our training
Mm-hmm.
that we are constantly learning. And so, with that background of constantly learning, it means that we're always looking for answers, searching for the answers to a problem. And that forces us in that role of an innovator very often.
Mm.
As far as being open to new technology, I think we're also cautious. And it's because we hold lives in our hands. And so we have to be careful what we are introducing, when we are introducing new technology, and making sure that it has been verified. But I think physicians are very involved in innovation, and we really need to be involved in innovation because we're at the bedside, we're seeing the patient, and if we see a problem that needs a better answer, then we should
Mm.
say, this is the problem. Maybe you don't have the answer, but the person next to you may be able to help you find that answer, and we can,
Yeah.
foster that innovation. But I think we are very, very involved in innovation and should be.
Yeah, yeah. I think I was reading a book. I forgot the title, and they were talking about how in the past physicians were like in the front lines when it comes to innovation, and that's why we saw this some surgical equipment or some type of new technology would come out and they would be named after physicians.
That's
Uh, but
right.
then, but then it was they started talking about how there are some regulations about conflict of interest and all these other regulations that came about, and kind of ended up hindering some physicians from innovating. But I think we still have that opportunity, as you talked about. We are in the bedside. We are the ones operating. We are the ones doing the things. And so it's so important that we have that mindset of, what can we do to make things better? And if we don't have the skills, right, we have partnerships. We have people around us who can help us to get there. So I think that's just so
Agreed.
important. Yeah.
And physicians
It's
do very well with partnering, very, very well. You know, we're
yes,
trained on team mentality, so we're
that's so
good with
true.
that. Yeah.
Yeah. Um, and so, as you talked about, we're in the middle of this pandemic, and hopefully things are really getting better. But with how COVID-19 has with the social distancing, and even some of the practices really have been closed just because of the elective services, right? So how did this whole pandemic affect your practice, and how do you think this is actually going to influence on how you practice in the future?
So we were affected also. So I do a mix of elective and emergency surgery, and my elective surgeries were put on hold. We just restarted elective surgeries this week, actually.
Mm.
So that was a big impact for patients who expected to have their procedures in March, and now they're waiting until May or June or July for their procedures. The other impact has been the introduction of telehealth. And so there was some telehealth being done prior to COVID-19, but once the pandemic hit, that became a really big part of the practice, so that patients are able to still get medical care but not have to risk exposure to
Mm.
COVID-19. I think that that is not going to go away and that telehealth is going to remain a part of the practice. In surgery, it's difficult for it to be, actually, it's impossible for it to be 100% of our practice,
Yeah.
because, we have to examine our patients physically, and, I can't see a hernia most times over the phone. It's
Yeah.
good for me to put my hands on and palpate. So it's not going to take all of the practice, but it will still play a role and what that means as far as reimbursements, as
Mm.
far as patient accessibility, as far as insurance payments, all of that is still to be yet to be seen.
Mm. Okay. Yeah. I mean, that makes sense. I guess, as you said, as a surgeon, it's going to be really hard to kind of do some of that telehealth, but maybe some of the follow-ups can be, maybe longer than that first few days, right? Unless somebody has an emergency or something. But
Mhm.
I think I can definitely see that in the near future, and hopefully we have kind of learned something along, this pandemic, and we can be able to have a more efficient practice, I guess.
I think so too. I think so
Yeah,
too. My dietitians and the psychologists in the office were able to use
yeah,
telehealth quite a bit and continue our bariatric patients or the weight loss patients along their journey, their
mm,
preoperative workup, so that was a good thing that happened, so that their preoperative workup did not just stop because of COVID-19, but could continue. So that was one good thing that happened. So I think telehealth is here to stay in some form or fashion for all of us.
yeah, yeah. Um, actually, one of the things I also wanted to highlight about your clinic and your practice was, as you just talked about now, the comprehensive aspect of, having a dietitian, having all these people in the team to just help this patient. Can you expand a little bit more about how that works when it comes to your patients?
Right, so we have a 360-degree view and treatment of the patient. So when someone comes to us for weight loss surgery, they're evaluated by surgeons, dietitians, psychologists, sleep medicine, pulmonary, cardiology, and many other specialties. And we're all in a multi specialty group. So it's very, very accessible for the patient. And we also have a coordinator that shepherds them through this process. And this happens before the surgery and after the surgery. Our philosophy is that the patient is walked along this path and they're supported the entire way. So this is not, surgery where you have the surgery and goodbye. No, this is a
Mhm.
family. We're supporting you to get you to your goal and continuing after. And so it was very, very important that we have a very comprehensive program. And we also have bariatricians, which are medical physicians that assist with weight loss. We have two of them in the program now that also work with us with the patients to make sure that they are achieving their goals and also that their medical treatments are up to date, their diabetes is under control, the hypertension, and everything else.
Mm.
So the patients feel that support.
Nice, nice. That's amazing. And I just remember when working with you, learning about that whole system, I really enjoyed knowing that this was just more than a surgery, right? This was somebody's life. This was somebody trying to tackle something, this challenge that's in front of them. And knowing that they had that 360 um, support was just such an amazing way to see, really combining primary care, combining literally everything, and just seeing a patient overall. So I think that's already innovative of itself. And so just to finish up, I wanted to ask you if you had any advice for students or residents and other physicians when it comes to innovation and maybe involvement on different things. It might not be them coming up with a new whatever, but what do you think is their role, and how can they, get more involved in such things?
I would say embrace innovation, keep your eyes peeled for opportunities to be involved. You'll see them, we all do. and when you see them, follow it through, and
Yeah.
ask for assistance, because my area of expertise is going to be different from your area of expertise. So
Yeah.
if we pull the minds together, then you
Yeah.
have a much stronger group and a much stronger way of getting that particular innovation out to help patients, because that's ultimately what we're here to do, is
Yeah.
to take care of patients and to train the next generation of doctors. And so, the more that we can do to further that and to improve patient care, the better. And that follows our Hippocratic oath. So
Exactly.
we'll make sure that you do that.
All right. Well, Dr. Johnson, I appreciate it. That was an amazing, just thoughts and ideas about how we can just be better physicians, right? It's not just about practicing medicine, but it's about treating people as people and knowing that we can improve people's health through innovation. So I learned a lot from you, and I know I'll still be learning from you in the future. So definitely we'll keep contact, and I'm so excited to see what the future is holding in bariatric surgery.
Yeah, all the best, Dr. Wibinelli.
Appreciate it. Thank you for listening to this podcast. I would really appreciate it if you could rate, review, and subscribe for more content. Feel free to follow me on Instagram, and you can also find the video interview of this podcast on YouTube. See the link in the description. Until then, see you next time.